Heart decided our way to thank AMR and ELNEC for the generous scholarships you're providing for our staff to go to training in January was to make a little video to introduce ourselves and to talk about the people that are going. So here's an introduction to Jacob's Heart. I'm Lori Butterworth, and I am the founder of Jacob's Heart Children's Cancer Support Services and also the co-founder of the Children's Hospice and Palliative Care Coalition. And one of the key elements that we've worked on at Jacob's Heart is the voice of families in pediatric palliative care, so that parents and caregivers, siblings are cared for throughout the course of treatment from the time of diagnosis all the way through the trajectory of treatment regardless of the outcome. We here believe that palliative care begins at time of diagnosis. So we are honored to be sending 3 family members, all with a different perspective, to the training. One, a mother of a child with cancer, another who was an adolescent with multiple relapses from lymphoma, and she's now a grown woman, and another bereaved sibling, a woman who lost her sister when she was young. And these are our staff at Jacob's Heart, and we look forward to them returning training.
I'm Anaya. I run the grief support program at Jacob's Heart. I am actually a Jacob's Heart member myself. My family and I lost our little sister. Her name is actually somewhere on that quilt.
I'm going to show everybody right there. Yeah.
So it's very honoring for me to be part of Jacob's Heart. I feel like it's part of me giving back. So what I do with the parents is I communicate with them and offer them our services, especially the support groups that we have for both Monterey County and Santa Cruz County. When you lose a child, it's not something you can forget. Some people expect us to forget, but losing a child, it's more of a healing process, and that's what I want to be able to accomplish. And by taking the ELNEC training, it would be so beneficial to bring those skills back home and train other people and help our parents and our community through that healing process.
My name is Michelle Marlowe. My daughter Emily was diagnosed with cancer when she was 4 years old. We were the first family to receive services from Jacob's Heart right after Jacob. And without the services from Jacob's Heart, I don't know where our family would have been. When you hear those 4 words, your child has cancer, your world is completely turned upside down. You feel as if you're in a swimming pool underneath the water, and all the words above the water are just garbled. You're just in a state of shock. Grief of childhood cancer begins at diagnosis, regardless of whether the child lives or dies. Thank you, ELNEC, for welcoming us parents to this training. Forward to coming back to Jacob's Heart and empowering other parents to advocate for our children.
My name is Mariela Medina, and I'm the family liaison here at Jacob's Heart Cancer Supportive Services. I'm also a 9-year cancer survivor from Hodgkin's lymphoma stage 4. I relapsed 3 times, and towards the end of my treatment, I got a stem cell transplant. When it comes to life and death, I feel like people can talk about it for hours. When it came to me, and I was told that I had Hodgkin's lymphoma stage 4 and that I had like a 40 or 30% chance of living, I honestly thought about my hair. Oh my god, I'm gonna lose my hair. And then 20 minutes later, I was like, oh shit, like I might die. And you know, it's funny now, but I went through a lot of different stages at that point. You know, I was angry and I was sad and I was mad, and you know, I thought about my family, my mom, like, you know, what I'm gonna miss, what I'm gonna not get to see if I pass away. You know, it puts life in a completely different perspective, and from there your mind is completely switched. You don't put anything else like clothes and hair first. You put health first, and that's the most important thing. And if there's anything I learned about cancer and surviving it, is that nothing is more important than your health. Nothing. I think for nurses, social workers, and our doctors, what I would ask of them is to be very resourceful, to be informative, to be loving, and to be our friend. When you have cancer, you're taken away from your regular life, so you're not around your friends, your family, your siblings very much, and so they kind of fill in that spot. So what I would tell my doctors, be very understanding to me, be my friend, be loving, be resourceful, don't lie to me, tell me everything I need to know, tell me what I can do to make myself feel better. For my social worker, help me, help my family, help me understand, things around me, be resourceful to my family, give them resources if they need anything, be there. And for my nurse, you're basically going to end up being, probably one of my best friends. You're going to see me, over 40 times in one night. Love me, take care of me, make sure I'm comfortable at the hospital. And, you can even have fun with us. We get bored in the hospital. So that's what I would tell them. The way I make connections with my teens usually varies. If I have them with me, we start talking about each other and what treatment I had and what treatment they had and how they feel. We crack a couple jokes that only people that have been through cancer have. And that trust is there, and they're able to talk to me about anything. And sometimes it doesn't even have to be about cancer. It can be about whatever they're going through in their life. But that trust and that connection is already made because I've already had it and I've experienced it. And I can actually say, I know what you're going through and I know how you feel. And they like that. They like that another person knows how they feel. They feel more comfortable with you. And so that's how connections are made, and that's how we like to keep it. Not forceful, nothing like that. Just whatever comes out, we kind of talk about, and that's it.
Now I am so honored to introduce you to two other members of our staff. These two women have expertise working with low-income, monolingual Spanish-speaking families who have a child with a life-threatening condition.
At Jacob's Heart.
I am the Family Support Specialist for South Monterey County.
What does that mean?
I help the families with financial resources, here supportive services that we offer, and also to community resources.
A lot of times at Jacob's Heart, when we talk about grief, we kind of expand the definition of grief. Mm-hmm. How do you work with grief with the families that you serve at Jacob's Heart?
With grief, I help them understand that grief does not only refer to a child passing away. Grief is first they start feeling the process of grief when they receive the news that their child has cancer, and throughout the treatment, that means losing family time with their other children if they have any other children. Mm-hmm. Even if the child does go through the cancer treatment successfully, then there's always that sense of grief because they don't return to their normal life that they once had.
And then you are bilingual, bicultural. You're such an asset to Jacob's Heart, an asset to the families in terms of understanding the grief process and helping families walk through the journey of losing their child when we do have children die. Mm-hmm. And could you talk about cultural perspectives on that and what you bring and can learn from that?
Culturally, I can relate to the families because most of my families are Latino families, and so I understand what their perspective of grief is. So my job is to try to make them not fall under the stereotype of what grief is, because in the Latino culture we believe that grief is just the death of someone, and it is something that we do not talk about. So my job is to help them understand that it's okay to talk about it. It's okay to share with others that are going through the same thing that they are.
And you develop relationships with all of the family members, especially siblings too, right?
Yes, it's very important for us to focus on siblings because they are the ones that are experiencing grief in general, because they don't see their little brother or sister as much, they don't see parents as much. Mm-hmm. So they're mostly oftentimes left at home with one parent while the other one's up at the hospital. So it's important to build that relationship with them.
And I want to mention too that you started at Jacob's Heart as an intern, a college intern, studying social work,
yes.
To get your bachelor's degree in social work, and you were such an outstanding intern that I decided to hire you. And so now we're really excited to build your capacity as a professional and to integrate what you're learning what you'll learn at ELNEC and through your job here, but also with your courses that you're taking and studying social work. So you in your job at Jacob's Heart, you interact pretty much on a regular basis with the oncology social work department at Lucille Packard Children's Hospital. So that's mostly your line of communication. And you also work with Coastal Kids Home Care and other agencies in our community that provide support. So you've developed skills in that. Do you think that having ELNEC training will help you in your communication amongst various providers?
Yes, it will, because sometimes just having that knowledge, having their knowledge and my knowledge, and just putting that concept together of what they're trying to, the message they're trying to portray, will help me understand them more.
And what's your commitment when you come back from ELNEC? How do you know that, like, AMR is making this investment in our organization? What will change? What will change about our organization?
I will be here for many more years.
Good. Yeah.
Yeah, and just being a part of this wonderful team and having that knowledge, and hopefully, like I said, be here for a couple more years.
Yeah, what do you think about our team getting all trained and everybody?
I think that's pretty cool.
Yeah.
That's amazing.
Yeah. We do good work now. It'll just get better.
Yeah, ELNEC will prepare all of us to just provide better services, to improve our services.
Yeah, and you have one of the children that you're working with right now very closely is passing?
Yes, she's currently passing, so unfortunately maybe I won't have the knowledge I'll receive once attending ELNEC to help the family through the process, but I'm going to do my best.
But Liz, your heart of compassion and the love and your smile and all of the joy that you give to these families, and they really trust you with your deepening of your educational knowledge around this. I think you're going to be an outstanding ELNEC trained professional.
Thank you.
Thank you. Laura. This is Laura Garcia. She's one of our family support specialists. And I just want to ask Laura a couple of questions about what you do, and I want to ask you about what's it like for a low-income, maybe migrant, undocumented family when they hear those devastating words, your child has cancer. How often do you interface with families like that?
Oh my God, it's almost on the weekly basis. When they hear the word cancer, they think their child going to die.
That's what cancer means in the Latino community.
Latino community, when you hear cancer or you see cancer, they just right away think that they're gonna die.
And how do you talk with them? What kinds of services do you and interactions do you have with families?
I do a lot of case management. I do counseling sessions too with the family. I do art therapy with the kids, and I do play therapy as well too.
Yeah. And what do you think you'll learn by getting more intense training dealing with palliative care and end-of-life care that you can bring back to the community?
To get more knowledge and help my families who maybe they, for some reason, they could be end of life for their child.
And you've lost several of the children that you've worked with in your time here, huh?
Yes.
Yeah. And then the grief support, that because they develop those relationships with you, and then that continues for so many years after the loss of their child. You're like a lifeline to those families. Yeah. So also, you have expertise as an interpreter for counselors.
Yes.
So that you've been doing that a long time, right?
Yes, for 8 years.
Yeah. How do you do? I'm so fascinated by how you do that in those really intense, difficult conversations. Being the interpreter in the room, what's that like for you?
It's really hard because you have to use words that maybe to help the family understand.
It's not just word for word translation. No. Yeah.
And you really need to understand the culture as well. Because sometimes counselors, they don't understand the culture.
Yeah, so you're doing culture. You're trying to interpret the counseling and the cultural context as well.
Yes.
And helping the counselors learn the cultural context around end of life death and grief?
Because almost 90% of the people that we serve, they're really low income and they work in the fields.
That's the population you work with, right?
Yes, yeah. And as well as Jacob's Heart here too, you know, almost all my families, they're super low income.
Laura, do you mind telling me how you started, where you started? Where did you start working? Where did you come from?
I worked in the fields when I was 13 years old.
And then you were first in your family to go to college?
Yes, I am. I'm the first who graduated from Cabrillo. Then I transferred to CSUMB.
Yeah, and now you're working as a counseling interpreter,
yes,
as family support specialist for Jacob's Heart.
Yes.
And you did just recently have a loss in your family as well. Yeah.
Yes.
Yeah, and so you bring so much perspective, and I'm thinking that this training is going to just build you up in your professional capacity, and we're just so honored to have you with us.
Thank you.
The families adore you.
Thank you.
She's a magical with these. The children love Laura.
Thank you. Thank you.
Siempre
I love working with the families.
Siempre están buscando a Laura.
Yes,
Yeah.
thank you.
Yeah. So we'll see when we come back from ELNEC, just the things that you'll learn and passing on this to this very, very underserved population that needs you to be really well trained. So
thank you.
We thank
and thank you so much.
Yeah. Okay.